There we go. Hi, everyone. Welcome back to the program. We'll get there eventually. We're almost at the halfway point of our program, leading us to our discussion of the morning, where today, as mentioned at the top of the program, we're going to delve into the topic of breast cancer, as today marks No Bra Day, a commemoration that was created. I believe it originated in Canada. It is aimed at educating women about breast cancer. I want to ask my colleague, Russia, is this a concern for you? Because you're still fairly young.
Yeah.
And when did you start, if so, when did you start kind of like thinking about it or doing
Yeah.
checks, if you do at all?
I think a couple of years back, there's a lot of campaign about breast cancer awareness, how important it is to check yourself periodically.
Right.
Because when it comes to this, time is the essence, right? As the earliest you can detect, the earliest as well you can treat it, and the possibility to be cured is also bigger. That's what I heard from the campaign.
That's right. And again, I see the same thing as well. I've always heard that you're never too young to check. So, I mean, there's nothing wrong with doing your self-checks at home. So many actually here that live in Indonesia still remain in the dark in regards to breast cancer, potentially delaying treatment, like Rasha mentioned, for those who could have been treated earlier. So today, here to share her insights on breast cancer is Dr. Steffanny. She is an oncologist at the Hermina Hospital in Jatinegara. Good morning, Doc. Thank you for being here today.
Thank you for having me here.
So let's get right into it by first discussing what are some of the most common factors that may cause breast cancer.
Actually, the etiology of the breast cancer is exposing a woman with estrogen.
Okay.
So estrogen is a stimulation for epithelial duct to proliferate. So when a woman get exposed to the hormone in the long term, maybe she has an early menarche or late menopause, or having a menstrual delay, and also when a patient has a family history of breast cancer, this is increasing the risk for having a breast cancer.
Okay.
And in regards to that, how high is the percentage of possibility when the family member has a history of breast cancer? Is it then rises up to above 50%?
It's not that much. Actually, if she has a family member that has breast cancer, it's increasing the risk about 1.5 times. But
Okay.
if they have a second generation, about more than 2 or 3, maybe it's leveling until 24 times. But actually, the breast cancer is not a hereditary problem. It's only 5% that really genetically
Inherit, I guess,
inherit.
right?
Yes, it's only 5%, but
Right.
most of them is sporadic.
Okay. Well, that's actually kind of scary as well, because then it can happen to anyone.
Yeah.
So let's talk a little bit about treatment and cures, Doc. Obviously, like Rasha mentioned, we all know that early detection is key to many illnesses and diseases, but in particular, breast cancer. Someone who has been diagnosed with breast cancer, how many different stages are there, and what are some of the treatments in regards to those stages?
Treatments are really variative based on the stage. Commonly, when the first patient came, we have to know the stadium, so we search about how far the cancer has spread. So firstly, we check about the breast, and then we check the axilla, the lymph nodes, and also we check how far the metastasis. We check about the liver, the lungs, and the bone, and also some can spread to the brain.
Really?
Yeah, but if we're talking about early stage, surgery is the first treatment. We go to surgery, and also there's hormonal therapy, systemic therapy. We have chemotherapy, and also targeted therapy. It's various treatment.
Do you think that really time is the essence? Because I've seen a lot of this campaign from breast cancer survivors that she got lucky because she detected earlier, and then she can go through all this treatment and she healed. But if she caught it a bit later, she could probably not make it. So how much of the essence time is in terms of detecting it? And can you paint a picture of potentially the treatment process, because for a lot of people it seems daunting, and the reason why we don't want to detect it in the first place is because we don't want to, deal with the reality.
Yes. Sometimes fear is really the key because they stop a person to get the treatment. Many persons have lump in the breast or the mass, and it's painless. So they don't want to check it because it's painless. But this is the first symptom that we have to check immediately. So we have to have breast awareness, like we have to self-check breast every month. And if you get lump or something that something different from day to day, your breast is maybe you have a skin dimpling, you have ulcer, or maybe you have nipple discharge, you have to get checked to the doctor. We can examine with physical examination first, and then we go through some radiologists, like we can have USG, mammography, or then if we suspect the lump is cancer, maybe we are going to biopsy. And there's a lot of choice to biopsy. We have a small needle, we have core needle. It's just a small procedure, and then you know is it cancer or not.
So it's so much better to actually caught from the stage 1 as opposed to later stage. So for example, if you got caught with stage 1, how long is the treatment process before you eventually cured, and what's the percentage of being cured?
Maybe we have to really make sure is it a cancer or not. So we do a biopsy, and then we can proceed into a surgery. There's a lot of option there. If you want to conserve your breast, there's a breast conservation surgery, and then we can adjuvant it with radiotherapy. And then after that, we have to look about the factors that were increasing your probability that sometimes it will recur. So we have adjuvant treatment, either is a hormonal therapy, or we need a chemotherapy, or we need targeted therapy. So it really depends on the
case-by-case basis, I guess, right? I'd like to, we had a conversation a bit earlier before we came on air. You mentioned something alarming, which is the number of those with breast cancer here in Indonesia are quite high. And I asked why, and it's not because we're living in a particular region or living a certain lifestyle, but because most people fear this, any sort of these treatments. So fearing an outcome, you don't get yourself checked, and because you're actually fearing the outcome, because following the outcome would be a treatment. So how do you approach this particular mindset? Because you've even told me that you've had patients that have been diagnosed and they stop treatment, and then, but they eventually come back when it gets much worse because they cannot stand it anymore as well. So how do you approach these patients that are, basically in fear of getting treatment? Like chemotherapy is absolutely scary. It's understandable.
I think the key is about information. Most of we don't know about the cancer. We just hearing things about very scary thing that you will die from chemotherapy. But actually, it really helps you a lot.
Okay.
And some people already came for metastatic disease. It grows in your lungs, grows in your liver, it grows your bones. It's very painful. But we have really various treatment for it now, and our government health insurance is very good. So you don't have to be worried.
Yeah, because one of the things, ongoing concerns would be like in North America, if there's no medical coverage, like how am I going to get this treatment because it's very expensive? But here, a lot of that is actually being covered.
And also, I think we've seen a lot in media, especially in movies, people going to chemo in a very bad condition, and then they don't really ever give information about how advanced the technology nowadays is. So I think in reality, it's actually there's a lot of options, right? The technology is advanced, and not all chemotherapy, also if I'm not mistaken, Doc, this is you can confirm, not all chemotherapy actually create the same effect towards people, and not all people would go bald, for example. It's depending on the stages of the cancer itself also, right? Is it correct?
Yes, if you get it from an early stage, maybe we don't have to chemo, maybe only surgery, because it really depends on the stage. So the earliest is the better.
Okay. Another thing that's quite alarming is that, much like any other cancer, you can never really be cured, can you, Doc?
Well, actually, maybe we just things about a remission.
Right.
There's the state of there is no active cancer, but well, in the long run, maybe they can recur back. So
now, what are the likelihood, like what are the chances of somebody who has successfully detected it early, had surgery, but so let's just say now that it's in quote unquote remission, what are the chances of it coming back? Because I've heard of many stories of people living full, healthy lives after.
yes, when we catch it in the stadium 1 or 2, it's quite good, but there's a subtype of cancer, but there is more better. One is less better. We know about there's a hormonal type, there's a triple negative, or there HER2 type. There's a lot of type that can differentiate your prognosis. Some tell that luminal type or hormonal type is better than the triple negative one.
Okay.
So there's various things that you can differentiate which one that high prognosis to relapse, someone is not.
Okay. But the keys to detection are all the same, despite all of these types. So could you give us maybe a walkthrough as to what are some of the symptoms? Because we do know a lump is likely the first thing that you would notice, and you can do self-tests at home. So what are some of these symptoms that people should be looking at?
Other than lump, there's a skin dimpling. It's like a dimple.
Okay.
But it's on your breast.
Okay, but there's no lump or anything. It's just on the surface.
No, it's just on the,
really?
just on the surface. Maybe it's just like a nipple discharge. There's nothing, but this nipple discharge can be blood or can be a serous, just a white thingy.
Okay.
Or maybe there's be an ulcer, or maybe it's just inflammation all the breast, or maybe it's just like Paget disease, one of the type of breast cancer. It looks like a scale on your nipple. Okay. It's itchy and scaly. You have to really get checked.
Just basically look for any abnormalities in general. Don't look for one particular thing. Okay, so why don't we play a little game of like myth or facts?
Okay, let's go.
Let's start with the first one. Men can get breast cancer, myth or fact?
Fact.
Fact, okay, so, but this is we don't hear about this a lot.
Because it's really small percentage, only 1%, but
okay, so when it comes to men, I know it's a very small percentage. What should we be aware of? Same thing, like any abnormalities?
Yes. There's a lump. Most of the lump is behind your nipple. Because,
okay.
Yeah.
All right, so there you go.
If you feel grow or pain, some feel pain, you have to get checked.
Okay, good one.
All right, now second myth. Is using deodorants and wearing bras can help trigger breast cancer? Is that true?
It's a really big myth.
Okay, this is a big myth.
Where did this myth come from? Because I've heard this too.
Yeah.
I've heard the second one especially.
They said about aluminum contained in deodorant or antiperspirant that block the secretion of your sweat, like accumulating toxin, but it's not true because toxin is eliminated by kidney or your liver, not from your sweat.
Okay.
So it doesn't affect that.
So one last one for me. Alternative treatments such as herbal medicines can help cure cancer. Is that myth or fact?
Oh.
I can tell by your reaction. This is so it's likely a
maybe
myth,
it's
right?
maybe it's just not. I don't recommend it.
Okay.
But
I think what people do is they try to alleviate symptoms, and I think that a lot of herbal medicines do help you alleviate some symptoms, for example, pain or any sort of other symptom, but doesn't actually, may not actually cure the disease.
Maybe it's just like an adjuvant that's supporting you, you're nauseated or you may feel weak.
Right.
Maybe you can add it your herbal therapy, but I don't think it can be a primary treatment. Still, surgery is the key, and also your adjuvant therapies can help you live longer and free of cancer.
Okay, I want to touch on one more thing that you mentioned earlier, which is, you know, technological medical advancements have now, you mentioned that you can even do a less invasive surgery that can preserve the breast. It used to be if someone had breast cancer, then they would have to have some sort of implant if they were to have another. So explain a little bit about that, procedure.
If you came early, you have a small disease, a small lump, maybe like 2 centimeters, we have an option here, like we can eliminate the tumor with negative margin. So we check all the margin that we left is still if negative or tumor, and then we can reconstruct nowadays.
Wow, you can even come out with a better breast then.
Yeah, there you go.
Actually, one more question. So during remission, there's a potential that it come back, but also a potential that it's cured forever, right? So I always talk about taking power of your health through your lifestyle kind of thing when it comes to your, your life, your health, right? So how much of a big difference lifestyle is when it comes to, for example, you got diagnosed and then you got cured, how important it is to have a very healthy lifestyle to make sure that it don't come back?
It's very important. One of the risks of breast cancer is lifestyle. We have to no smoking, stop smoking,
Okay.
don't drink alcohol, and then we have to really get active. You have to go
Like
sports.
exercise.
Exercise
Okay.
5 times in a
Week.
week, and for 30 minutes is already enough. And then know
But
what
nutrition.
Yeah.
nutrition is really important. We have to eat high antioxidant things like green vegetables, and also less intake for fat.
Oops. Are there any certain food that trigger this cancer hormone?
Actually, no.
Okay.
Actually, a breast cancer patient can eat everything. Actually, there's nothing that you don't have to eat.
This is a myth as well, by the way. We spoke about this earlier.
Right.
Sometimes people get confused because then certain people, perhaps your family member, will say, oh no, you can't eat that.
Yeah.
Because that. So there's really no actual restrictions apart from
correct.
generally eating healthy.
What about processed food, Doc?
Yes, that we think about the food is really healthy food,
Oh,
fresh
okay,
food,
okay,
not
whole food.
also
Yes,
not
yes,
processed
yes.
food.
So basically, the rule of thumb is to eat whole food. Within that group of whole food, then there's nothing that can trigger your cancer, right? Okay.
There you go. Well, any last messages since we are celebrating No Bra Day, commemorating people to have more awareness about breast cancer? There can't be, obviously there can be a lot of misinformation out there. What's your perhaps advice to those out there that wish to know more and need to know more about breast cancer?
You should get your breast checks every month.
Okay.
If you see something that's should change, don't afraid. Just go to your doctors and then you ask about it. Don't get afraid and don't get shy. Sometimes people shy about asking about
It's true.
things about it.
Well, if they have a doctor like you, Doc, we would be very happy to go and like to consult, because
Definitely.
it makes a lot of difference to have someone that we know will be there for us throughout the process.
Someone you trust?
Yes.
Yeah, absolutely. Thanks again, Doc, for coming by. And we hope that you, our viewers, are better informed about breast cancer. And please keep your loved ones informed as well. We're going to take a short break here on the program, but when we return, we'll have the latest from around the world when we return. Stay with us.